2 as passed by Lok Sabha be taken into consideration. Those in favor will please say aye. Aye. Those against will please say no. I think the ayes have it, the ayes have it, the ayes have it. The motion is adopted. We shall now take up clause by clause.
सामना कर रहा है, इसलिए पानी की बर्बादी को रोकया जावे। धन्यवाद।
श्री HD देवगौड़ा, नॉट प्रेजेंट। डॉक्टर राधा मोहन दास अग्रवाल।
धन्यवाद सभापति महोदय। यह विषय केरल के पालघाट जिले के आदिवासी क्षेत्र आत्रपाड़ी में बच्चों की मृत्यु दर बहुत अधिक होने के संदर्भ में है। केरल के जिले पालघाट में एक आदिवासी बहुल ब्लॉक आट्टपाड़ी है। पिछले 10 वर्षों से वहां बच्चों की मृत्यु दर केरल ही नहीं वरन देश के औसत दर से भी अधिक है। केरल बहुत कम मृत्यु दर के लिए राजा बलि के ज़माने से पूरी दुनिया में विख्यात है। आज उसी केरल के आदिवासी क्षेत्र में न जाने किन कारणों से दसियों वर्षों से बच्चों की बहुत अधिक मौतें हो रही हैं। भारत सरकार ने अपनी ओर से विशेष प्रयास किया और 120 करोड़ रुपए की विशेष मदद की। इसे मिलाकर राज्य सरकार ने 250 करोड़ रुपए खर्च किए। 3 फैमिली हेल्थ सेंटर, 28 सब सेंटर, 5 मोबाइल यूनिट और 1 सुपर स्पेशलिटी हॉस्पिटल के बावजूद मौतों का सिलसिला अनवरत जारी है। 30 योजनाएं चलाई जा रही हैं, फिर भी 50% औरतें कुपोषित हैं। आंगनवाड़ी नॉन फंक्शनिंग हैं और कम्युनिटी किचन्स बंद पड़े हैं। सारी स्कीमों का पैसा और व्यवस्था कहाँ जाता है पता नहीं चलता। गर्भवती महिलाएं अट्टपाड़ी से पालघाट और पालघाट से त्रिशूर के बीच घूमती हैं। अट्टपाड़ी के नागरिकों की फूड हैबिट में जबरन परिवर्तन भी इसका कारण बताया जाता है। इन परिस्थितियों में अट्टपाड़ी में केंद्र सरकार की ओर से बाल रोग विशेषज्ञों, स्पेशल साइंटिस्ट, फूड न्यूट्रिशनिस्ट, आदिवासी समाज की प्रणेताओं का एक विशेष दल 3 जनजातियों की भाषा विशेषज्ञों के साथ भेजा जाना आवश्यक है। टीम में बायोकेमिस्ट और हेपेटोलॉजिस्ट और उनकी टीम भी होनी चाहिए। बच्चों की अत्यधिक मृत्यु का कारण पता किया जाना बहुत आवश्यक है, अन्यथा अट्टपाड़ी केरल और भारत में एक सामाजिक व्यवस्था पर प्रश्न चिन्ह बना रहेगा। धन्यवाद।
डॉक्टर वी शिवादासन।
Respected Chair, allocation of funds for Mahatma Gandhi National Rural Employment Guarantee Scheme. Mahatma Gandhi National Rural Employment Guarantee Scheme is supposed to provide 100 days of employment to the rural poor in India. But the scheme is affected by the increasing wage arrears and the workers are forced to seek work elsewhere. The skyrocketing inflation along with the unemployment has put the rural poor under extreme distress. The rural unemployment continues to remain high. In this context, the government should take proactive steps to ensure that the allocation of NRG is immediately increased so that the 100 days of employment can be achieved. There are several complaints about wages not being paid on time, depriving the poor even of the meager income they can have. Millions of workers have not been paid for months. The rectification of the situation is urgency. The government should take immediate steps to clear the dues and release additional resources so that the poor people of India can enjoy the limited legal right they are offered in the form of assured 100 days of employment. The scope of the scheme should be widened by including more works under its purview so as to increase the efficiency of the scheme to create assets in rural areas. Thank you, sir. Thank you.
Dr. John Britas.
Sir, thank you so much, sir. Sir, it's a matter pertaining to the gender justice. हम दो महिला शक्तिकरण के बारे में लंबा भाषण दे रहे, कुछ नहीं करते। Mahila Erection Bill. It's pending for so many years. Sir, it is a pressing priority that the government should provide. Sir, Agrawal ji, aapka, mera baab hi Kerala se.
Go ahead, please.
Okay. It is a pressing priority that the government should provide free sanitary products to school-going girls, as there is direct link between school dropout rates and period poverty. This brings to light a larger pressing issue, that of the pink tax, and how women literally pay a heavy price, higher price, simply for existing in the world as non-men. From girls' toys to women's personal care products, goods for females cost more than their male counterparts, sir. Sir, how can the cost of raising a girl child be permitted to be higher than a boy when the sex ratio of females at birth of children born in last 5 years is 929 as per the National Family Health Survey? Sir, 12% GST on sanitary products was removed only after widespread protests. But the actual benefit to customers were very little. Exemption of output GST resulted in denial of input tax credit to local manufacturers, which means they would be taxed while buying raw materials and has no option of getting back the money when they sell. Thus, there is not much price benefit which they can pass down to consumers. Even the base price is too high whenever women earn much less than men. Women work more, earn less, and are left with even less to save. There can be no Beti Bachao, Beti Padao when this is the norm, sir. Hence, I urge the government to abolish this price discrimination and provide free sanitary products to school-going girls, sir. Thank you, sir.
Shri Sanjeev Arora.
Thank you, Honorable Chairman Saab, for allowing my matter of urgent public importance. Subject is providing affordable health care. Honorable Chairman, sir, I would like to bring to your attention that people are dying due to non-affordability of health care available. In corporate hospitals and institutions run by so-called charitable trusts is forbidding as far as cost is concerned. We need to cap as many medical charges as possible, especially for IPD patients. We also need to make sure that cost of medical facilities is near to CGHS rates, if not the same. Especially, we need to make sure that institutions, hospitals getting income tax exemption from government should not make profits which are extortionate to even upper middle class population. Forget about middle class, lower middle class, and below them. I therefore urge upon the government to cap medical charges and make health care affordable to all, particularly in hospitals getting income tax exemption. Thanks.
Dr. Amar Patnaik.
Thank you, Chairman, sir. So I rise to make a statement on the demand for Committee on Maternal Health under the National Clean Air Program. Sir, the Air Quality Life Index by the Energy Policy Institute at the University of Chicago states India has contributed 44% to the global rise in air pollution since 2013. The data suggests the average Indian resident may lose 5 years of life expectancy unless WHO guidelines on air quality are followed. India has a PM 2.5 concentration of 60.15 micrograms per cubic meter of air, over 11 times more than the WHO permissible limit. The public health emergency posed by air pollution is particularly distressing in terms of the deadly impact on maternal health. The United Nations Interagency Group for Child Mortality Estimation projects that 2 million stillbirths occur globally annually. A global study by Nature Communications suggests 39.7% of stillbirths in low and middle income countries may be caused by air pollution, specifically PM 2.5 pollutants. India reports an annual average of 217,000 stillbirths. These numbers are in sharp contrast to the declining global stillbirth rate since 2000. The National Clean Air Program is yet to address the impact of air pollution on maternal health. Thus, in this battle against a rising public health care emergency, I urge the government to form a dedicated committee under the NCAP to further investigate the links between air pollution, maternal health, stillbirth incidents, and child health so that time-sensitive solutions can be designed. Thank you so much, sir.
Srimati Priyanka Chaturvedi, not present. Dr. Ashok Vajpayee.
माननीय सभापति महोदय, आपकी अनुज्ञा से मैं लोक महत्व के एक बहुत महत्वपूर्ण विषय की ओर सदन का ध्यान आकर्षित करना चाहूंगा। जवाहरलाल नेहरू विश्वविद्यालय की दीवारों पर जात विशेष विरोधी नारे लिखे जाने से एक बड़ा सामाजिक वैमनस्यता का वातावरण उत्पन्न हुआ है। महोदय, देश की राजधानी के एक प्रतिष्ठित विश्वविद्यालय की दीवारों पर जाति विशेष ब्राह्मण बनिया के विरुद्ध आपत्तिजनक नारों का लिखा जाना सामाजिक सद्भाव को बिगाड़ने का एक कुत्सित प्रयास लग रहा है। जो विश्वविद्यालय कभी अपनी शैक्षणिक और सोचपरक उत्कृष्टताओं के लिए जाना जाता था, आज वो टुकड़े टुकड़े गैंग और अलगाववादियों के समाज विरोधी कृत्यों का केंद्र बनता जा रहा है। आज विश्वविद्यालय सामाजिक सद्भाव बिगाड़ने के केंद्र के रूप में प्रयोग किया जा रहा है। अभी विश्वविद्यालय की दीवारों पर जाति विशेष के विरुद्ध जिस तरह के नारे लिखे गए, वो अराजक तत्वों की समाज विरोधी मानसिकता को प्रदर्शित करते हैं। ऐसे जेएनयू में भित्ति चित्रों एवं ऐसी कलाओं के माध्यम से अपने उद्गारों की अभिव्यक्ति पहले भी होती रही है, परंतु अभी की घटना में कुछ जातियों को देश छोड़ने के नारे लिखकर वामपंथी और अलगाववादी ताकतें क्या संदेश देना चाहती हैं। निरंतर देश की जनता द्वारा ऐसे तत्वों को नकार दिए जाने के बाद भी हताशा में इस तरह के नारे आदि लिखकर वैमनस्यता को बढ़ाने का प्रयास किया जा रहा है। जेएनयू विश्वविद्यालय प्रशासन को एवं भारत सरकार को इस घटना को गंभीरतापूर्वक लेकर ऐसे शरारती और सांप्रदायिक तत्वों के विरुद्ध कठोर कार्रवाई किए जाने की आवश्यकता है। जो जातियां देश की आजादी की लड़ाई में अग्रिम भूमिका का निर्वहन करती रहीं, देश के निर्माण में जिनकी भागीदारी अनुकरणीय रही है, अपनी प्रतिभा और मेधा से समाज को आगे बढ़ाने में सक्रिय रही हैं, उनके विरुद्ध जानबूझकर घृणा पैदा करने का उनका ये प्रयास अत्यंत निंदनीय है। लोक महत्व के इस विषय को सदन के संज्ञान में लाकर सदन का ध्यान आकर्षित करना चाहता हूं और सरकार से तत्काल आवश्यक कार्रवाई किए जाने की मांग करता हूं।
श्री संजय सिंह, not present. Srimati JB Mathir Hasim.
Thank you, Chairman, sir, for the opportunity. I wish to make the statement on the subject maximum inclusion in welfare pension scheme. Sir, it is the duty of the nation to ensure a dignified life for the deprived sections like the elderly and the widows in the context of higher cost of living. Government should come forward to increase central share of the pension scheme under the National Social Assistance Program, NSAP. It is a need of the hour to take appropriate measures to restructure the current criteria for social security pensions under NSAP from household to individual indicators instead of restricting the assistance to the beneficiaries in BPL families. It is essential to simplify the formalities to ensure that the elderly persons with minor income would not be forbidden from the social security pension. Instead of complete exclusion, government must have a better approach focusing on maximum inclusion of widows, elderly or disabled persons as found eligible, regardless of their family background. Such an approach could reduce dependence on their relatives. India's elderly population is projected to touch 194 million in 2031 from that of 138 million in 2021, according to the National Statistical Office Report 2021. The prevalence of non-communicable diseases such as diabetes, hypertension, etc. is high among the elderly, the treatment cost of which turns out to be higher. The inverse relationship between poverty and higher out-of-pocket health expenditure should not go unattended. At this juncture, I urge the government to be kind enough to accommodate the maximum number of beneficiaries under the NSAP. Thank you very much.
Shri Tirupati Siva.
Thank you, Chairman, sir. Sir, my special mention is Jan Parsad's withdrawal from the collaboration with All India Radio on the occasion of the Public Celebrating Day, Broadcasting Day. Sir, on November 12, 1947, Mahatma Gandhi addressed the Indian refugees camping in Kurukshetra through a live broadcast arranged by All India Radio. More than 50 years later, in 2001, this day was officially declared Public Service Broadcasting Day. Since then, Jan Prasad, a civil society organization, had been collaborating with All India Radio to commemorate this day on Gandhiji's memory every year. However, this year, Jan Prasad withdrew from the collaboration. Reason is, every year a new school performs at the celebration. This year, the school choir, which was supposed to perform 2 songs at the broadcast, was asked to drop one of them without the knowledge of the civil society partner. The song was Gandhiji's favorite Christian hymn, Make Me a Channel of Your Peace. Additionally, the reason cited by the All India Radio for not including the hymn in the broadcast was that since the hymn was in English and therefore it could not be sung, it was instead replaced by the performance of the BSF brass band. Moreover, since 2000, All India Radio has celebrated the day by organizing an outdoor function replete with Gandhiji's bhajans and with people seated on the ground as Gandhiji would in his mass contact program. This year, however, the program was moved indoors into the AR's newly constructed Rang Bhavan auditorium, where the hour-long program was telecast live. These shocking turn of events by All India Radio go against the values propagated by Gandhiji, the values that must be honored for more generations to come. Thank you, sir.
Srimati Priyanka Chaturvedi.
Thank you so much, Honorable Chairman, sir, and my apologies for not being there when my name was announced. So this subject is extremely important, measles outbreak in the state of Maharashtra. It is a matter of grave concern that the measles outbreak in the state of Maharashtra has claimed the lives of as many as 15 children in a month. The city of Mumbai alone has reported more than 200 cases in 2 months. It is perturbing to note cases such as that of a child barely 5 months old succumbing to such serious health hazards due to lack of access to proper healthcare and vaccination facilities. This also highlights the weak state of healthcare and public medical infrastructure in the country. Given the highly contagious nature of the disease and lives of millions of children of Maharashtra at stake, it requires prompt and alarmed action on the part of the state government. Further, while the central government set a target in 2017 to vaccinate 405 million children, the targets could not be met due to the pandemic. As the government has directed that significant resources towards vaccination of COVID-19, there have been rising concerns over children missing their regular vaccines. Thus, it is necessary to ensure that the universal immunization programs are not overturned by health emergencies. In this regard, steps such as door-to-door vaccination, early detection, and preventive measures are the need of the hour. It is also necessary to ensure efficient implementation of the guidelines. Therefore, I urge the government to understand the urgency of the issue and take steps towards it. Thank you, sir.
Honorable members, the special mention rendered by Dr. John Britas has invited a response from Mr. V. Muralidharan under Rule 258, 261. Since it was not raised, immediately thereafter, I'll look into it. The House stands adjourned to meet at 1100 hours on Tuesday, the 13th December 2022.
Consist of recovery of loans of 9,500 crores, miscellaneous of 24,590 crores, and 3,76,000 crore has been transferred to the state government, sir. Lot of opposition members were talking about the federal structure of this country. So the union government has already transferred to the tune of 3,76,000 and demand for grants may be 10,000 crore rupees हम transfer कर रहे हैं, sir. Sir,